unfortunately, this is a very common scenario in ICUs across Canada today. This individual, a vital member of a community, a vital member of a family, has suffered a catastrophic illness that has landed them in the intensive care unit on a breathing machine. Now, over the past couple of decades, we've made significant advances in our ability to take care of these people so that we can enable their survival. But along with these advances has come an unexpected outcome, and that's the development of a new disease known as intensive care unit acquired weakness. When you have critical illness, you start to lose muscle. That muscle loss and that weakness can be severe, and in some people it can last forever. So basically, if you're older than 45, and as I look around the room, I don't want to make any assumptions, but if you're over 45 and you have been in the ICU with a critical illness for 2 weeks or longer, when you get out of the ICU, you have a 50-50 chance of never being able to walk up a flight of stairs, never being able to bathe or dress yourself independently because of severe persistent muscle loss. Why does this happen? Well, we know in critical illness, muscle dissolves. It literally does. Some people grow it back, some people don't. And I just want to show you a specific example. In front of you is a CAT scan of your thigh, anybody's leg, on cross-section. And here on the outside is the skin. Here's the femur, that's your bone in your leg. This gray stuff is all muscle. There's your quadriceps, there's your hamstrings. This is what the muscle looks like normally. This is the leg of a patient I had in the ICU who had a severe pneumonia, and that's what they looked like when they got out of the ICU. That light gray muscle, it's gone. But more disturbingly, 6 months later, it hadn't grown back. We don't know why this is happening, and our team wants to look at the reasons for this. We've made advances already. We've found that in people who don't have enough muscle coming out of the ICU, they've lost their satellite cells. These cells repair injured muscle. We know that there's not enough of them. Now we want to find out why. So the next phase of our studies is looking at the mechanism or the reason for loss. Is the cell's environment messed up? Is there not enough blood flow? Are they not functioning normally? Can they not self-regenerate? Are they not responding properly to stimulus like exercise? By looking at satellite cells in people coming out of the ICU who get better and people who don't, and comparing them, we'll come up with the mechanisms that underlies this disabling disease. Nobody coming into the ICU should have to trade one disease for another. And we believe that our research team has the potential to provide future critical illness survivors the ability to return to a full, active, productive life and not just a simple existence. Thank you.